Well, tell us just first of all, how many people are diagnosed with this form of cancer? Like, is this a less common form of cancer?
Actually, it is the fifth most common cause of cancer worldwide. Men are twice as likely to be diagnosed as women, and people more than 55 years of age are more likely to be diagnosed with this cancer. So I wouldn't say that it's an uncommon cancer. I think it's fairly prevalent in the community.
Wow, I had no idea, and I definitely didn't realize that it was more common in men. So do we know what causes this type of cancer?
Yes, we do have some established risk factors for these cancers. The most common risk factor is a bacteria called Helicobacter pylori that can be diagnosed. It presents as a form of indigestion, and if it is treated with antibiotics, that can prevent the cancer. Some other risk factors are having a diet that is high in salt and smoked and processed meats, increased body weight, less vegetable and fruit intake. So those are some of the risk factors that we know of, along with the genetic conditions that can potentially lead to this type of cancer. But most about this cancer is still unknown.
What about acid reflux? I know people with acid reflux are at a higher risk of esophageal cancer. Does that go down to the stomach as well?
Absolutely. So acid reflux, so H. pylori bacteria can cause acid reflux, and acid reflux from the diet and a processed diet can cause increased risk of cancer. So it's very important that patients who have acid reflux, they get treated for it appropriately in order to avoid the anatomy of the stomach to be changed into a malignancy.
So H. pylori and acid reflux can lead to this type of cancer, but then is it the opposite too? Are these also symptoms of this type of cancer, or what are the symptoms?
Yes, so some of the symptoms that are most commonly prevalent, so the symptoms would depend on an early or a late type of gastric cancer. In an early gastric cancer stage, the symptoms are more likely heartburn, any discomfort in the abdomen, especially the upper abdomen, any bloating sensation, if there's a feeling of food getting stuck in the throat, any nausea, vomiting, they're always concerning. Any blood in the vomitus is very concerning. Unintentional weight loss, any decrease in appetite, so those are most common symptoms for the gastric cancer. Unfortunately, we do not have any screening guidelines for the general population yet, so I think it's very important for everyone to keep an eye on their bodies and talk to their doctors if they have all these symptoms or any of these symptoms. Actually.
Yeah, I mean, those symptoms can be also signs of other types of cancers too. So definitely a good thing to mention to your doctor. And then what would, if it was cancer, what would treatment look like? And is stomach cancer, are you able to survive stomach cancer?
So that depends on the diagnosis. If it was detected earlier, then there is a chance for a surviving stomach cancer. But unfortunately, because the symptoms present usually when the cancer has invaded into the stomach lining a little bit, most patients, unfortunately, are not able to survive stomach cancer. And that's why early detection is very important. Now, the treatment can include from surgery, radiation, chemotherapy medications, immunotherapy medications, and targeted medications. But that would depend on the stage of the tumor that it was diagnosed at.
Yeah, no, this sounds like a bad one. Nobody wants this. How could people change their lifestyle habits now to prevent getting a type of cancer like this?
Absolutely. So I always recommend to my patients, and I would recommend the same to all of the public, that we should really look into what we are taking and putting in our bodies in terms of diet. Increasing fruit and vegetable intake has shown to decrease the risk of cancers, especially in colon and breast cancer. But we are also seeing some impact in the gastric cancer world of things. Keeping a healthy weight, keeping a healthy BMI, and exercising appropriately are some of the good ways to try and prevent this cancer. And also, if there's any symptoms, do not just discard them as, it's just going to go away. Talk to your doctor, especially heartburn and indigestion. And the population is just starting to think that that's just normal to have, and it's not.
Yeah, because it's so common among us, but
Yeah.
it's definitely something that you want to get checked out.
Yes, and most patients with heartburn and indigestion would not have a cancer, but we don't want to miss the ones that do. So most patients will undergo an endoscopy. That's a procedure done by your doctor to look inside the stomach, and they will not have any evidence of cancer. But I would still recommend getting checked out and talking to your doctor rather than ignoring these symptoms.
Yeah, because chronic heartburn can lead to things like this as well.
Absolutely.
Dr.
Yes,
Maqsood,
absolutely.
that was really helpful this morning. Thank you for sharing all of that information. We appreciate you joining us.
All right. Thank you for having me.